Hi, my name is Tulane Mitchell. This is Benny Mitchell. I am a PT1 student at Nova Southeastern University, conducting this interview for cultural competency with Dr. Shaw. The purpose of this interview is to learn and understand how CHF has affected Benny's life and how this illness has made him feel. This is a confidential interview. It'll only be shared with my professor, Dr. Shaw, on our closed blog site. A little narrative of background. Benny Mitchell is a 69-year-old African American male. At the age of 53, he was diagnosed with CHF, and now he is a retired postal worker. In 2009, he moved to Florida, and since then, he's had a couple other health issues, and we'll get into that a little later in the interview. To start, why don't you tell us a background of your illness, how you learned about CHF?
Well, I never really knew I had a heart problem. Say I was a letter carrier in Pennsylvania for 32 years, and I always complained about being tired. And I asked my fellow workers how they felt, and they also said they were tired. So I just figured it was from being tired of working hard. So I had gone to a doctor and asked him about it, and they checked into some things. First they thought I had a lung problem, which I went to a specialist and I didn't have a lung problem. And then it was sickle cell. They checked for that. It wasn't sickle cell. And then they thought maybe I had leukemia. So I had a bone marrow done and found out that my white cells were abnormally high, and maybe this was causing me to be tired all the time. And then finally, they diagnosed that I had diabetes, which I never knew I had because I worked and I walked about 10 miles a day. So it was more or less disguised because being a diabetic and not knowing, I had a silent heart attack. And they kept saying, you never asked me, did I have pain in my chest? No, I never had. I said, if I did have pain, I would have went to the doctor. But they say people that are diabetics have silent heart attacks. Mm-hmm. So it was a learning experience for me. So I had a heart angiogram, I think they call it, where they go through your groin and into your heart to see what's going on, and they found out I had a blockage. So they put a stent in, and it lasted about 2 months. I was feeling good. They put the stent in, and I went back to work in about 3 days and was feeling pretty good. And one day I come home from work and I felt like I had indigestion. It wasn't painful. Mm-hmm. It was just like indigestion. I drank a soda and it moved a little bit. And my wife said, you better take an aspirin to help you. And I did. And what happened, it got a little more intense than just indigestion. It felt like someone was squeezing my heart. Mm-hmm. So I went to the local hospital, and they checked me out, and they gave me a nitroglycerin pill, and the pain almost went completely away. And in a little while, it gradually started coming back like a drum beat. My heart started to get that squeezing, tightening sensation, and told them they had just put a stent in Pittsburgh, and they contacted my doctors in Pittsburgh, and they told me, they said, well, you're going to have to go back and see your doctor in Pittsburgh. And I said, when? In a week or 2 weeks? They said, no, in about 3 minutes when the helicopter lands. So I was off to Pittsburgh, and that's where they found out that I needed a bypass. And I had the bypass done in Pittsburgh about 3 days later. And from then on, I've been coping with it, and I've been doing pretty good. I had the bypass done in 2001, and I'm just watching what I'm doing. I can't do a whole lot, but doing fairly well. So, but you've got to eat right and know your limit on what you can and can't do.
Do you want to explain a little bit about the diet that they've given you and what guidelines you kind of have to go by now?
They gave me a heart healthy diet, but when they questioned me in Pittsburgh Hospital, I was already eating all the right things. And I was getting the exercise by working the way I did, so I think it was mainly the diabetes, and when they narrowed it down, the diabetes actually came from Agent Orange, from the herbicides that were sprayed on me in Vietnam. So in 2009, I moved to Florida to the good weather because I couldn't breathe in the cold weather with my heart condition, and the heat seemed to help. But I went back to Pittsburgh for a checkup in 2010, and I was going to a dental appointment at the VA that morning, and I started getting sick. I started throwing up, and I was brushing my teeth, getting ready to go to Pittsburgh for my dental appointment. And I started getting this tremendous headache over my right eye, and it was like a headache I've never had before. And I said, this must be a migraine, because it's really intense. And I kept throwing up. So I rushed to the doctor, my local doctor, and I went into his office, and they gave me a little cup. I said, I have to throw up. They gave me a little cup. I said, I need more than that. So I was on my knees throwing up in the garbage can. And he said, I think you're having a stroke. So the hospital was a couple blocks away. So I got to the hospital, and they gave me this shot, TPA. And within about 10 minutes, once again, I was on a life flight to Pittsburgh, and I had a stroke. I had a clot over my right eye and one in the middle of my head in the back. So then I returned to Florida, where I'm making ways and trying to watch what I eat and getting a little exercise, and that's about it.
How, immediately after the stroke, what emotions were you feeling? How did it make you feel?
A lot of crying, a lot of uncontrolled crying. My wife would say, why are you crying? I said, I don't know. And it was different for me because I wasn't really a crier, but I cry a lot easier now. But at that time, it was just crying over things I didn't know why I was crying. And I guess that's a disease also they call PBA, or something that has to do with strokes.
Right. So tell me about your autonomy and how this illness has affected your caregivers, like your wife. How has it affected her role?
Well, she's been understanding. I guess she tries to take care of me more because she knows I have a condition, but I guess it's a little harder on her. But I'm in a lot better shape than a lot of other people because the stroke didn't paralyze me.
Right.
And when I left Pittsburgh, I could hear the doctors behind me saying, there goes a miracle, because I could have been dead. I was the only one that walked out of the stroke ward that week.
All right. So after you found out about your illness, you said you cried a lot. How did you cope with that? What were some things, some stress relievers, something that made you feel better afterwards?
A lot of sleep, a lot of rest. When I was sleeping, I wasn't crying. So they told me I needed a lot of sleep to get back to where I needed to be. So I did that. I tried to follow instructions.
Hmm. So tell me, what age did you retire? At 53, you said you were diagnosed with CHF. Were you retired at that point, on your way to retirement, or did this cause you to retire?
Well, like I said, 53, I work inside the post office.
Hmm.
I couldn't work outside because of the heat. I couldn't work in extreme heat,
Hmm.
and I couldn't work in the cold at all. So I couldn't go outside. So I stayed mostly inside to work, and I retired at 55. And I could have stayed there and worked inside, but there was too much stress inside the post office
Hmm.
because I was the union president, and I couldn't take my fellow employees being harassed. It seemed like it made my temperature rise.
Stressful situations.
Yes.
Yeah. Okay. So being away from that environment, being away from the stressful environment, and moving down to Florida has helped since then, and helped kind of manage CHF a little better for you, I would assume.
Yes, yes. People don't realize that stress is a major factor when you're trying to get well.
Yeah.
And that's why I left the post. Like I said, I was probably in a position where many people wanted to be, where they couldn't really harass me, but I couldn't take the stress that was going on around me. So stress means a lot. When you're more relaxed, it seems like you can heal better.
That's true. Yeah, stress is definitely a negative factor in healing. Another thing I wanted to discuss was the incident that happened in 2011. When you passed out, do you want to give a little background information on that as well?
Okay. This is another example of stress, I guess.
Mm-hmm.
I was sitting in the garage one day and reading the paper, and my son had just left with his family from Georgia, and I guess there were some things going on where it was a little stressful having his entire family around, and so they had left, and I got up to walk into the kitchen, and my hand started shaking. I couldn't stop it.
Mm-hmm.
And I came in and told my wife, I said, look at my hand, something, I can't stop it from shaking. And so I sat down in the kitchen, and she went to get some help. And I thought I could walk to the living room where I'd be more comfortable, but I got up and I just fell right down on the floor there, collapsed in the kitchen. And since I was on blood thinners from the stroke, when I fell, I bruised my right side, and I was in the hospital for a week. I couldn't walk. And once I got to the hospital, and the bruise settled in, my whole right side and chest was purple.
Mm-hmm.
So it took about 2.5 months to heal, and since then I've been doing pretty good.
Good. And now, how are your feelings after that incident, after the silent heart attack, after the stroke, and now having to deal with that on top of it? How did you feel?
Well, it just showed me how vulnerable I was, that I had to look out for myself.
Mm-hmm.
So it was pretty scary, especially with the blood thinners,
Mm-hmm.
being bruised the way I was, and how long it took me to get back. And I think when I fell, they wouldn't release me from the hospital when I fell because my heart rate wouldn't come up. But I actually think that I had bruised my heart, and they, for some reason, I guess, didn't understand it. But I had a little nurse that came and packed me in ice for the whole night. Every time the ice melted, she packed me in ice again.
Mm-hmm.
And that next day, I got up and walked. And I couldn't walk before, so it took the ice to bring me back, to bring my heart rate back up.
That's actually a good segue into my next question about how is your relationship with your healthcare providers, the nurses, the doctors here in Florida versus up in Pittsburgh and Pennsylvania? Was it a good experience? Was it bad? Were they helpful?
Oh yeah, definitely. Because before that, like I say, I never knew I had a heart condition, and I didn't deal with doctors that much, other than to get a regular checkup.
Mm-hmm.
Matter of fact, they even gave me a test for my heart in Pennsylvania before they even caught the silent heart attack. And I had the stress test one day, and they said, "Oh, can you go 3 more minutes?" I said, "Sure." I was a mailman. I went 6.
Mm-hmm.
They said, "Oh, you did great." They told my wife, "You did great," and the next week is when I was in the hospital for my heart. So stress test is not the not the thing people think it is.
Great.
You can pass a stress test and your heart still be bad. So
That's true. Yeah.
you learn as you go.
Do you have a healthcare provider that stood out to you the most that you would say really aided in your recovery of any of the situations?
Well, I think that a lot of the information that I got after the heart surgery out of Pittsburgh, the different pamphlets they gave me, I read, and that helped a lot because I followed most of those rules. And like I say, the diets, they said, man, that everything you're eating is what you should have been eating.
Right.
So I was eating the right things.
Did the doctors discuss at all with you, because you were so healthy beforehand, that this may have been a family genetic disease, something that could have been passed on to you?
No, there's nothing really in the family that would suggest that this was a family problem.
Okay.
I think it was more or less from Agent Orange and not knowing. If I'd have known from the beginning, I was going to the VA and they kept denying for 40 years, and it was just disgusting to go so long, and they knew what they did to us, and for them not to admit it after all those years, you get disgusted and you distrust the VA, and I think the VA could have done a lot better.
Yeah. So with everything that you've been through in your whole life in this last 20 years and even before then, how has after the heart attack affect your role in your life as a husband, as a father, as a brother? How has it affected you?
Well, it had made me think about my health. It's made me look at all the people around me and really figure out what's going on. And since I am the oldest one in my family, you could say I'm the patriarch. And it seems like I can read people a lot better than the people around me seem to read others. I've looked at them, I've seen them grow up, and I know which ones have the evilness in them. And I more or less don't talk about people. I'd rather for you to see it with your own eyes than you believe it. You know, sometimes you tell people, well, this person is not the person you should be putting your trust in. And they say, oh, I know them, they're good people. I know better.
Yeah, this experience has made you more vulnerable in the sense that you're able to see beyond people and see into people a little more. Yeah.
Definitely. And sometimes people look at me, why would you think that of them? I watched them grow from kids. Like I say, I'm the oldest. And I know I'm better than anybody in my family. There's been some treacherous people around my family, and I know. So, but they don't know, and a lot of them are skeptical when I tell them about them. And I said, okay, I'll tell you once, but after that, you're not going to believe it until you see it with your own eyes.
Yeah.
And it comes true. It all the time comes true. But it's been an experience to go through these health problems. It helps you grow.
Yeah.
So.
Last thing before we wrap it up, what advice would you give anyone else in your similar situation going through these issues that feel discouraged? Because really, you're a success story. Like the doctor said, you survived a heart attack, a stroke, passing out. What advice would you give to someone, some encouragement?
I would say the biggest thing in life is treat others like you would want to be treated, and I think probably the biggest thing is you've got to realize with your health that stress will kill you just like cigarettes and bullets. And stress is a factor, so you've got to more or less live carefree, but you've got to be aware of your health. And then the doctors are not always right. You have to have something within you that says, this is not good for my body. Because I have done that. I have turned down some instructions from doctors, and it's turned out that the doctors weren't always right.
You gotta listen to your body is the main thing, yeah. This was a good interview. Any final thoughts for this interview? I think it was good. It's very insightful to get to know that this side of people's life. An illness affects, your whole life. The well-rounded, your wife, your kids, your life, your livelihood. So I think Benny is a survivor. He's endured a lot, and he's kept a good head on his shoulders about the whole thing. I think his advice about limiting stress is very, very important. Stress plays a major role in your health. It was a pleasure interviewing you. Thank you so much. And I look forward to sharing this with my professor. Thank you.
Okay, thank you.
I believe that this interview was good. I think Mr. Mitchell did an awesome job at storytelling and painting the picture of how he felt during that time and in the moment, and exactly what was going on in his life at the moment. It was very insightful. I really appreciate the part that he mentions about keeping stress low, and how stress does affect your healing, and how stress can affect what illnesses may happen because of stress also. I also like the fact that he says he listened to his body. You need a second opinion sometimes, and sometimes you just need to listen initially to the aches and pains. As he was referring to in the beginning, he didn't think that there was anything abnormally wrong because everyone else was dealing with it. But listening to his body and letting the doctors test him for other stuff has saved his life ultimately. I think this also was a good interview because as a healthcare provider, we need to remember that patients are usually diagnosed with more than one illness. They have suffered more than one thing, whether it be a stroke, a heart attack, a seizure. And I believe that we have to address all of these issues together, whether it was 10 years ago, 15 years ago, in order to treat the patient wholly and treat the patient in the best way that we can. It's insightful getting to know someone's background, and insightful getting to know what people go through on a day-to-day life.